Life is based on breath, and without breath, there is no life. And the breathing organ responsible is the lungs, which is the most important organ in the body. We call it as a generator, which is situated on both sides of the chest. And this generator is pumping up and down, absorbing air in and out, and absorbing oxygen and giving to all parts of the body, including the heart. So the lung is responsible for the working of the heart. The lung is abnormal, the heart will not work, and other parts of the body will not work. Now, asthma, what is it? It is a disease of the air tubes, which you call it as bronchus, the trachea, and the small tubes. And when this small tubes and the large tubes, the trachea and the bronchus, gets narrowed, and there is a swelling inside the air tubes, the air gets resistance to pass through, and the patient feels the asthma symptoms. And what are these symptoms? The symptoms of asthma are mainly: number one, breathing difficulty, shortness of breath, heaviness of chest tightness, or there will be a stony feeling over the chest. It can be accompanied with paroxysms of cough. Asthmas are mainly of three types. One is an allergic asthma, the other is a non-allergic asthma, which is not related with allergy, or it can be a mixed type. What is allergic asthma? This is mainly because when it is exposed to certain protein-like materials like dust or pollens or food materials, of any kind of food materials, from prawns to beef to anything, and nuts and anything can produce that, or funguses, house dust mite. These are what is called allergens and produce the breathing difficulty and chest tightness, and that's called allergic asthma. The other type is the non-allergic asthma, which is not related with allergy, and you get this when you are exposed to cold, when you are exposed to chemicals, when you are exposed to fumes in occupational environment. These are the common, or when exposed to certain strong perfumes. And this type of asthma is not allergic, they are non-allergic asthmas. There are a group of patients who has both allergic as well as non-allergic asthmas. This is called mixed type of asthma patients. Asthma patients will also have sneezing, and they may also have skin lesions, which you call it as eczema. Three common most forms of asthmas are, we call as phenotypes. The one is VC type. They will always have the sound coming in and out along with the breathing problem. There is another group of people which is called cough variant asthma, seen in children as well as in adults. They will have more of coughs, less of breathing difficulty. And the third type is what is called exercise-induced asthma, seen in children and athletes. And when they run, they get a cough or they have a chest tightness. So these are the three common forms. And the most common investigations that we advise is the blood, where you do a serum IgE level. The blood eosinophil count, and the sputum eosinophil count. The severity of asthma can be assessed and monitored by simple measures like peak flow meter. You can measure the peak flow of the breath when you exhale, and this is used for monitoring. In the clinics as well as in the hospital, we do a little bit of investigations on the lung function, which is called spirometry, which measures the airway resistance, the airflow in and out, the velocity, the volume of air that is going in and out, and assess the severity, and you base the treatment on the severity based on the lung function test. Now, how to manage the asthmas. Number one is to identify the allergens. Number two is avoid the allergens. Keep the air without pollution in the house, like without dust accumulating in the cot or in the beds or in the cushions, and less curtains, and also dehumidifying the air so that you can avoid the fungus. The medications that you commonly use are: number one, to dilate the air tubes, and number two, to reduce the inflammation and swelling. And usually the medications are given in the form of inhalers. There is a misconception among the population that if you use an inhaler, you are dependent on that, it will be lifelong, you have to use it. But this is a misconception, it's wrong. If you are really treating asthmas, it can be well controlled and you not be dependent on the inhalers, and you can live without any medications. Asthma is a well controllable disease, though not curable, because it is a genetic disease, but it is well controllable, and you can have a healthy life, and a healthy lung will lead to a healthy heart and a good quality of life. Thank you.